Circumcision is a minor surgical procedure performed at a part of the body with major importance for most men. It is therefore important to achieve the best outcome possible because even if it is a simple operation, things may go wrong. In this video, I will introduce you to 3 tricky little gadgets which make circumcision so much fun you would go for it a second time if only it was possible. The first is the Shang ring. I just love the simplicity of it. It comes in 32 sizes, so it will fit any penis. It only takes a few minutes to perform. There is an inner ring you place under the foreskin and an outer ring which is placed on the opposite side. Once tightened with the foreskin in place, the ring works as a template and all that is left to do is cut away the foreskin with scissors using the ring as a guide. The ring is then pushed back behind the coronal ridge of the glans. No stitches are needed. The ring falls off by itself after 10 to 14 days, and here you go. Device number 2 is the Prepex ring. As the Shang ring, it is approved for adults and comes in a number of sizes. First, one has to measure how much foreskin is to be removed. Then, the appropriate size of the device is chosen. A plastic ring is placed over the glans and the foreskin is then rolled over it. Now, a tight rubber band is placed around the penis from the outside on top of the inner ring. The skin gets strangulated and after 7 days it will fall off by itself, or what still is attached may be cut off. Even here, no stitches are needed, but there will be a wound that will have to heal over the course of the following weeks. Another device I like a lot is the Alisklamp. You put a plastic tube on the glans and the foreskin is then drawn over the tube and the tube locked so that the foreskin can safely be cut against the walls of the tube without risking injury to the glans of the penis, which is one possible complication of the Shang ring. Even here, no stitches are needed. The tube is removed after a couple of days. There are a lot more of these devices, but I think the principle has become clear to you. I think there are some major advantages of these circumcision aids compared to the classic freestyle-like methods with knife or scissors left to the artistic discretion of the surgeon. Using these aids saves a lot of time with excellent cosmetic outcomes with minimal risk for taking off too much or too little of the foreskin, because if too much of the foreskin has been removed, erections may be painful and the penis might even bend with erections. The prepuce is extremely stretchable, meaning that it is incredibly easy to cut off too much with the classic technique. Another advantage I see with devices like that is that there is no need for cauterization to stop bleeding. As you might remember from my video on frenuloplasty, there are a lot of nerves in that area. I mean, a lot. And you don't want to unnecessarily fry what's left of them because this will increase the risk of loss of penile sensitivity, which is a possible side effect of the procedure. The devices work well in routine situations. With diseases of the prepuce like BXO, it might be wiser to rely on the classic approach, but it depends on the individual parameters. Just in case you are wondering, this is not a video about reasons for circumcision. It is only about technical aspects. But just to give you an idea, in my opinion, there should be a reason for circumcision. Don't go for it just for fun. Thanks for watching. Bye bye.